Hi, I'm Brian Finestein. I'm the CEO at St. Clare's Health, and the name of our show is Let's Talk Health. I'm here with Dr. Dan Ferrante, our Chief of OBGYN here at St. Clare's, and we have a series of questions that we've gotten from the community that we wanted to ask him so that in this period of COVID, hopefully we can make the community feel a little bit more comfortable as they get their care here at St. Clare's. So Dr. Ferrante, first question, probably the most frequently asked, should we postpone our family planning during this COVID pandemic?
That's a great question, Brian. So we're not recommending that patients delay or postpone pregnancies. It doesn't appear that there's any vertical transmission from the mother to the baby during pregnancy. We'll certainly know a lot more a year from now. But as of right now, we have no case studies of infection from mother to baby. Not only that, we have the vaccine that's out now, which should confer immunity. We're recommending, I think we'll probably discuss vaccination for pregnant women. But no, delay of childbearing shouldn't be a question.
Okay. Dr. Ferrante, during this time, you know that moms are nervous. I guess it's in their nature. Difficult time, should they be taking any additional precautions?
Well, standard social distancing and mask wearing, really hand washing is sufficient. We know from the healthcare workers that all those methods work. So as long as a pregnant woman is washing her hands, social distancing, wearing a mask whenever appropriate, that's all she really needs.
Okay. Well, on the other hand, we test all the patients that are coming into the hospital, whether they're going for the OR, they're coming into OB. So what happens if a mom comes in and she's tested positive for COVID and she's ready to deliver? What should she expect?
So isolation is the obvious first answer to that. So a positive COVID mother in labor is in a special room with negative pressure, so air is only being drawn out of the room, so virus particles can only be drawn out, nothing can be in. Protective equipment is used by all her caregivers. No one will be allowed to leave the room who's with her while she's in labor. We will consider her partner also very likely COVID positive, and they'll be treated as one person. So her significant other will not be allowed to come and go. They will be all in that room until discharge. As far as the baby goes, the baby, if the mother's asymptomatic, she will have the option to room in with the baby. Breastfeeding is not contraindicated, but the mother, again, will have to wear protective gear while she breastfeeds, hand washing and a mask while nursing, but doesn't appear to be any vertical transmission through breast milk to the baby at this point.
Now, what if it's a more difficult delivery and we need a neonatologist and or the patient and mom have to get in the NICU?
So the NICU rules are evolving as we speak. They've changed several times. As of right now, the mother is allowed to go to the NICU, but that changes periodically. So we don't have a hard and fast rule for that as of now.
Okay. Shifting gears a little bit, so should the mom get the vaccine?
We don't have a firm recommendation yet from the American College of OBGYN or the Society for Maternal Fetal Medicine. However, they are recommending vaccination for pregnant healthcare workers. So if I'm going to extrapolate that to a few weeks from now, my guess is that all pregnant women will be recommended for vaccination. That's been, so far, the messaging we've been getting from the American College is that vaccination is going to be recommended for all pregnant patients. But as of right now, the recommendation is for pregnant healthcare workers to be vaccinated and for pregnant patients to discuss the pros and cons with their obstetrician.
Dr. Ferrante, so if the mom is nursing, is it still okay to get the vaccine?
Yes, there's no contraindication with lactation for the vaccine that I know of at this time. COVID-infected mothers are allowed to breastfeed, so I can't imagine why the vaccine would be contraindicated in that setting.
What if it's a difficult delivery and we need the help of a neonatologist and or a NICU?
So here at St. Clare's, Brian, we have a level 2 nursery, which means that any baby above 32 weeks is kept here at the nursery with our team of neonatologists that are present 24/7. As of right now, they're recommending isolation for a baby and a symptomatic mother. And the rules are evolving on visitation for the mother with the baby in the intensive care unit. The neonatologists, again, here at St. Clare's, are changing their protocols pretty frequently. As of now, it appears that the mother is allowed to see the baby in the NICU.
So Dr. Ferrante, if mom and dad are coming in for the delivery, what should they be bringing with them, mindful of the fact, again, that during COVID, you cannot go back and forth?
So that's a really important question that we're asked all the time, Brian. It's very important for the mother and the partner to plan ahead for this, and to remember that they're not going to be able to come and go from the hospital because it's not safe for them or for everybody else. As a result, they have to plan they need to plan on bringing everything they need for that stay, including a car seat, any medications or snacks, et cetera, that the partner may want, because we won't be providing that for the husbands or the significant others. And again, the most important thing is to bring a car seat and plan as if you're going somewhere and not being able to come back. It's like going on vacation and not being able to come back from wherever you are to bring your belongings.
Dr. Ferrante, during COVID, it's hard to have on-site classes like we normally do, childbirth classes, et cetera. What are we doing now during COVID?
Oh, well, the hospital, St. Clare's, has done a great job at this. They've set up virtual tours that many of my patients have had and really liked. They got a real feeling for the setting. The other thing that's been done is that a virtual childbirth class and virtual support groups as well have been established to meet the needs of the patients who can't physically come to the hospital during the pandemic.
I asked you earlier about, should the baby have to go into the NICU? What frequently happens under normal circumstances, there are times where the baby has to stay and the mom is allowed to go home. Pre-COVID, the mom can come and visit with the baby every day and sort of hang out, if you will. What do we do during this pandemic where we are limiting, in fact, visitation?
So currently, visitation in the NICU is limited to one visitor in the NICU. This may all change now with the vaccine. Mm-hmm. The protocol is probably going to look more like proof of vaccination, you can come in. No proof of vaccination, you probably can't. So my guess is that we're going to be encouraging vaccination. Now that may be a few months off. As of right now, the protocols in the NICU are one visitor, and they're encouraging all those visitors to be tested as frequently as possible.
Thank you, Dr. Ferrante, and thank you for watching Let's Talk Health. Please feel free to reach out and look at future programs, as well as our website, www.stclares.com.